Hey guys, welcome to Radiology Lens. In today's session, I will be talking about early pregnancy ultrasounds, specifically targeting the key anatomical structures visible in the first few weeks. In this video, we'll examine the early gestational sac, yolk sac, the early embryo, and discuss their clinical significance in confirming pregnancy, viability, and development. Let's dive into the ultrasound findings. Our first image shows the early gestational sac, typically visible around 4 to 5 weeks of gestation via transvaginal ultrasound. The gestational sac appears as a well-defined anechoic structure within the endometrium. At this stage, it's important to distinguish between a true gestational sac and other potential pseudosacs, as the latter can occur in cases of ectopic pregnancy. On ultrasound, the gestational sac should measure approximately 2 to 3 mm in size at the time of its first appearance. It's an essential early marker of pregnancy. However, it's important to note that the absence of a visible embryo or yolk sac at this stage does not necessarily indicate an abnormal pregnancy, as these structures may not be seen until later. As the pregnancy progresses, around 4 to 6 weeks, the yolk sac becomes visible within the gestational sac. This image shows the yolk sac, a critical structure that provides nutrients to the developing embryo before the placenta becomes fully functional. The yolk sac appears as a small, round, echogenic structure within the gestational sac. It is typically the first sign of an embryo's existence, and it is usually present by 5 to 6 weeks of gestation. A yolk sac that measures greater than 5 mm in diameter may raise concern for possible pregnancy complications, such as the risk of miscarriage. Clinically, the presence of the yolk sac is reassuring, as it indicates a viable intrauterine pregnancy. However, the absence of the yolk sac by 6 weeks may suggest an abnormal pregnancy or impending miscarriage. By 6 weeks, the early embryo begins to be visible on ultrasound. In this image, we can see a small echogenic structure representing the embryo. Around this time, the embryo may also exhibit a detectable heartbeat, which is a crucial marker for confirming the pregnancy's viability. It is important to note that the early embryo is typically seen as a small linear structure, often with the fetal pole identified. The heartbeat may be visible as early as 5.5 to 6 weeks, though it may not be detectable in all cases at this stage. At this stage, measuring the embryonic crown rump length is a critical step in dating pregnancy and assessing for any anomalies. A CRL of 2 to 4 mm correlates with about 6 weeks of gestation, and absence of a heartbeat at this stage could suggest an abnormal pregnancy, such as a missed miscarriage. Together, these three key structures, the gestational sac, yolk sac, and early embryo, provide essential information for early pregnancy dating and determining pregnancy viability. Abnormalities in these structures, such as the absence of yolk sac or embryo at the appropriate gestational age, may warrant further clinical investigation. To summarize, early ultrasound findings are vital for confirming the presence of a viable intrauterine pregnancy. The gestational sac marks the first sign, followed by the yolk sac and early embryo, which help us assess the health and progression of the pregnancy in its initial stages. Thank you for watching this educational overview of early pregnancy ultrasound. We hope this video provides valuable insight for your studies or clinical practice. For more in-depth discussion on ultrasound imaging and early pregnancy, don't forget to like, share, and subscribe. If you have any questions or would like to discuss a specific case, leave a comment below. See you in the next video.